I am so excited to have you meet Dr. Jordan Porter today. In this two-part series, Dr. Porter is our first occupational therapist that we've ever had on Concussion Corner, and I am so happy to bring her to be a part of the integral team that we talk about at Concussion Corner podcast. We will speak about all things occupational therapy, the role of vision in concussion rehab, equipment, integral team members in the rehabilitative team, and structure of an evaluation, and so much more. Without further ado, let's meet Dr. Jordan Porter.
Are you a healthcare professional looking for a trusted concussion resource? Then you've come to the right place. From her New York City studios, welcome to Concussion Corner with your host, Dr. Jessica Schwartz.
And now, a word from our sponsor. Did you know that sport helmets are rated on a 5-star system similar to cars? And the safest helmets have nothing to do with price, brand, or availability? Since 2011, Virginia Tech researchers have been providing unbiased helmet ratings that allow consumers to make informed decisions when purchasing helmets. The helmet ratings are the culmination of over a decade of research identifying which helmets best reduce concussion risk. This work is done as part of Virginia Tech's service mission and is 100% independent of any funding or influence from helmet manufacturers. Our mission at Concussion Corner is to expose you, the listener, to trusted spaces in the concussion arena that translate to clinic next day. Please visit the Virginia Tech Helmet Lab website in our show notes or at bit.ly/Virginia Tech Helmets and spread the word to aid in lowering concussion risk in your community. Thank you for tuning in, and let's begin the show.
Jordan Porter is a board-certified pediatric occupational therapist. She is currently the acute care occupational therapy team supervisor at the Children's Hospital of Philadelphia. During her 11 years at CHOP, she has worked as an occupational therapist on the inpatient rehabilitation unit, in the outpatient clinic, and in the acute care environment. Dr. Porter received her remedial vision certification from Salus University in 2018 as part of her occupational therapy doctorate completion. Jordan joined the interdisciplinary concussion team and began a development of the remedial vision program at CHOP. At this time, the occupational therapy department offers remedial vision services to clients with concussion-related vision issues, as well as those with developmental vision concerns. The remedial vision at CHOP is offered at 8 campuses in Pennsylvania and New Jersey and includes 15 therapists trained to complete comprehensive vision evaluations and treatment. We are so stoked to have Dr. Jordan Porter join us as our first occupational therapist on the Concussion Corner podcast. Jordan, welcome to Concussion Corner.
Yeah, thanks for having me. Excited to be here.
I'm so stoked for people to meet you. You know, you're our first occupational therapist, so I am so excited. So I'm happy that our listeners internationally will get to learn about you today.
Yeah, gotta represent.
Yeah, yeah. You guys are a quiet profession, I have to say. Like, the PTs are out there, physicians are out there, athletic trainers, but the OT, you're hard to find.
We really are, and I don't know what that's about, but it's my own personal little mission to just make sure that people know what we're doing and make sure that we get the credit that we're due.
Yeah, absolutely. And, just so our listeners know, we were kind of warming up a little before we started the podcast just to get in sync. And Jordan and I actually met very briefly. I saw her present at Children's Hospital of Philadelphia. She works with Dr. Tina Master, who's been on our podcast before. The new international consensus statement just came out from BJSM. She's on 9 of 16 documents. We're so proud of her. And we're so lucky to have her on those documents. And it just so happened after a long day, like my second full conference back from pandemic times. And, Jordan comes on and she's the final person presenting for the day. And I was like, do I skip out early? Do I stay? I started to feed. The coffee was going. And I totally leaned in with you, Jordan. You did a great job. And I was so stoked to meet you after the conference. And we're just so excited to have you on Concussion Corner podcast.
Thank you. I appreciate it. It was definitely a little bit scary to go last. So thanks for that feedback.
Yeah, no, I definitely was leaned in and I was super stoked. And, and I think really just to highlight, I'm so excited to highlight what an occupational therapist is for our listeners. Again, just to repeat and reiterate, like our listeners, we're trying to cater to the healthcare professional internationally, to really be able to reach across the aisle to understand, hey, here's what I as a physio can do. Here's what you as an occupational therapist can do. Here's how we can play well in the sandbox together for our patients. And here's how we can treat together. So I would love for you to kind of kick it off and just kind of highlight what an occupational therapist is kind of from a general sense. And then we'll talk about how it's really salient to have you on a concussion rehabilitative team.
Yeah, absolutely. So occupational therapists, I think our tagline is that our job is to make sure you're able to do all the things throughout your day, from when you wake up to when you go to bed, that you want to do, that you need to do, and that you're expected to do. And so I think as an OT, it's really cool that we can work with a wide variety of patients on a number of skills. We have a good bit of like a physical background, but we also do a lot of the sensory processing piece, the cognitive piece. And so we really get a kind of a wide breadth of a knowledge base that allows us to touch a good number of client factors and impairments in our clients to really make sure that we're able to meet them where they're at and make sure that they are able to do the things that they need to do.
Mm-hmm.
I think another cool thing about OTs in general is like a big difference I think that we bring to the table is we don't just look at the person and how we can change the person, but how we can change the environment and how we can change the task, because you can't always change a person's client factors. You can't always change their cognition, but can we change the task? Can we change the environment so they can still participate and do all of those things? So a really cool, unique profession.
Absolutely. Yeah. And I think what's so unique is that you guys occupational therapists in general can also really have a heavy background in engaging with the cognitive deficits just in a general population, not just concussion population. So if you're working with more like neurological patients, like a stroke or ABI patient, MS, et cetera, you're really have been addressing vision and cognition, and we know in general about 70% of our sensory environment comes through our eyeballs. So how are we supposed to negotiate in space, and process what we're doing cognitively if we're not intaking information through our visual fields properly? So it'd be so great to kind of hear how you have treated other populations, or how occupational therapists in general treat other neurological populations, integrating some cognitive and vision rehabilitation kind of combined.
Yeah, absolutely. I think working in a hospital environment, kind of the bread and butter of what we do as OTs is your morning self-care routine, getting yourself dressed, going to the bathroom, going to the shower. And there is such a huge cognitive visual component to that. I mean, think about sequencing that task, making sure that you have all the steps that you need, making decisions to make sure that you're executing that task safely so you're not tripping and falling. There's so much that goes in from a cognitive and a visual perspective. So as an OT, we're thinking about what skills can we remediate? How can we change this environment? How can we change this task to make sure that our clients are able to do all of those things to their utmost ability and able to participate in meaningful ways?
Absolutely. And really well stated. And, coming in as a physical therapist, there's always those jokes of PT, OT, and, how back in the 80s and 90s, OT took upper extremity, PT took lower extremity. And then here we are right on this podcast, talking about cognitive deficits and integration of, multimodal interdisciplinary rehab and things like that, and how we play well in the sandbox together. With that being said, I would love for you to kind of caveat into a little bit of your journey, as an occupational therapist at Children's Hospital of Philadelphia, kind of how you started, and then let's kind of ease into how you ended up in concussion rehab area, because I think it's a really unique and fascinating story. And I really hope that other occupational therapists out there hear this journey of yours, because I hope we can replicate you, 100 times over. So I'd love to hear that journey.
Yeah, so I started as a new grad, fresh out of OT school at the Children's Hospital of Philadelphia on the inpatient rehab team. A lot of traditional kind of familiar pediatric rehab clientele, those after orthopedic injuries or surgeries, those patients after stroke, brain injuries. And I think because of the hospital environment where I'm in, a good number of patients with pediatric oncology, specifically neuro-oncology diagnoses. And so from brain injury, from neuro-oncology diagnoses, from stroke. We had a really high number of these patients who had pretty significant acute visual changes. So they would be a typical 7-year-old before surgery. They'd have a brain tumor removed, and then they would come to us in inpatient rehab with double vision, a significant eye misalignment. And in rehab, we were like, all right, sit up, get up, walk, get yourself dressed, feed yourself. Okay, now we're going to have you practice school tasks. And our kids were just like, so overwhelmed. They were exhausted. They were symptomatic, and they just weren't able to functionally take in visual input, make decisions about it, and go about their day. And so as a brand new OT, I kind of was looking at my colleagues going like, what can we do? What are we able to do here? And so started probably 2 years into practice, took a continuing ed education event with Dr. Mitchell Scheinman, who is a very well-known optometrist. He does tons and tons and tons of work looking at the impact that different vision therapy and the role that OT can actually have in vision. Tons of research. He's very well published and respected in our field. So took a course with him, kind of got my feet wet, started dabbling a little bit in inpatient rehab, went back to get my occupational therapy doctorate, specifically at Salus University, because they offered a remedial vision certification where I would get to train with Dr. Scheinman specifically. And so it kind of worked out timing wise. I switched from inpatient rehab to the outpatient environment, started getting some post-concussion adolescents on my caseload, was finishing up my remedial vision certification. And Dr. Scheinman was doing some research with CHOP, and the concussion team really needed an OT with a background in vision to help with their vision research. And so he kind of introduced me to Dr. Tina Master, started to form that relationship. And from there, the concussion team at CHOP was really excited about getting OT involved, about having remedial vision to be offered in-house for our concussion patients. So we got the funding and all the behind the scenes, logistics set up to kind of form the remedial vision program at CHOP that we have today. So we see both patients after concussion, and we also see pediatric patients with developmental vision concerns. We're participating in a couple different research projects and just growing and growing and growing as more people find out that we're able to help their kids.
I love it. And I would love for you to hear, I'd love to hear from you. What are you seeking when we're supposed to be reaching across the aisle? Because again, most people think of physical therapy when they think of kind of rehabilitative services. So what do you want people to know? And by people, I mean healthcare professionals.
Right.
Why would I want to send my concussion patient to, like, why and when is an appropriate time to send a concussion patient specifically to occupational therapy?
Yeah, I think that's a tough question, and probably so dependent on who your team is kind of made up of. I say that I'm spoiled that we have like this phenomenal interdisciplinary team that I get to work with, where we have the concussion physicians, we have developmental optometry on board, we have physical therapy, we have physical therapists who also do vestibular therapy, we have a psychologist, we have a neuropsychologist. So we've kind of been able to tease out our distinct roles. I know that there's phenomenal OTs and other programs who are doing really supporting a lot of the mental health and well-being piece post-concussion. I know a ton of OTs who are doing some of those more traditional physical therapy roles and kind of helping with return to physical activity. There's OTs and other concussion programs who are doing a lot of cognition work. I think at CHOP, because we have all of these individuals who have kind of carved out those pieces for themselves and are doing it so well, that for us at CHOP, we're really the vision people. And so when there's a patient identified with vision concerns, they make their way to us. So because we're a younger and newer program, not every provider knows that OTs can get involved in vision. Not every family knows. And so I think just like really having a good lens of, is there something going on here from a visual perspective? Are some of these symptoms of dizziness and school difficulties and fatigue? Could there be a vision piece? And if so, do we have a developmental optometrist? Do we have an OT with some vision training on our team to kind of get their assessment, get their input, to kind of figure out what's causing the delay in our kids getting back to sport and school and leisure and all the fun stuff?
Yeah. And, for me, the training is so important. So I want to kind of hone in there for a second and just kind of like lean in. And, when we're speaking about concussion rehab, we're really speaking about providers who are trained in concussion. So it's not the
Right.
profession per se, right?
Right.
So I really want to lean into kind of your journey. We're a little bit more than halfway through this first one, but I want to kind of hear about your specific training and to kind of let people know like what that looks like. We've spoken about how occupational therapists can shine in so many areas of concussion rehab, from COG and autonomic issues and things like that, just kind of short-term, long-term goal planning, and how their functional day-to-day goes from ADLs and IADLs. But for your journey specifically, how did you kind of get trained in your vision certification? And, I know you were, let me just make sure I get this right in my show notes. I know when you were an acute OT, you were really looking at high prevalence of with their kids with posterior fossa tumors. And then, fast forward to where you are now in outpatient concussion rehab, kind of how that all kind of really linked in together, at the end of the day from a rehabilitative standpoint to get these kids back and functional. Because again, we have to connect to about 2/3 of those brain's pathways are devoted to vision. About 70% of our sensory environment comes through our eyeballs, and how important that is to function in our life, especially as kids who don't have the subjective language to express the what and how they're feeling with what's going on with them. So I'd love to kind of hear your journey, and why you're so uniquely qualified to treat, vision and your point of convergence issues and things like that are related to secondary to concussion.
Right. So I think that there's a lot more, like we've talked about, that goes into vision than just, can you see 20/20? Do you need glasses like myself to see far away, to see my notes on the computer screen? And so for me, as part of my occupational therapy doctorate, I was able to pursue a remedial vision certification. So it was, I couldn't even pretend to tell you how many hours, but 4 courses across 4 semesters of really kind of honing in into what makes up your vision. The model that I prescribe to from my training, that Dr. Scheinman, the developmental optometrist, really kind of promotes, is this 3-component vision model. And so you have like visual integrity, which makes up your refractive needs, the shape of your eyeball. Do you need glasses? Maybe any visual field impairments. So that's kind of how your eyes are able to take in that visual information. And then you have visual efficiency, which is your binocular vision skills, your accommodative skills, your eye movement skills, saccades and pursuits. And then the 3rd component, which I think is what OTs kind of do really well, is that visual processing piece. So visual motor integration skills, visual perceptual skills. And I think that area is so comfortable and familiar for OTs. We do it a ton in school. It's such a part of what we do, but then I think I think a lot of providers miss this visual efficiency piece. What are your binocular vision skills? What's your accommodation like? What are your eye movement skills like? And that's kind of where my training allows us to kind of come in and uniquely really provide intervention and remediation in those areas. So the training that I did, like I said, was with Dr. Mitchell Scheinman, who was a developmental optometrist who previously had his own practice and was offering vision therapy. And so he trained us as part of our coursework and our certification, our in-house labs, on how to appropriately and in an evidence-based way screen for visual impairments in our patients, when and how to make appropriate referrals. And then we actually learned the remedial vision techniques that are traditionally part of a formal vision therapy program. And so it kind of allows us as OTs to kind of bring our perspective, especially as pediatric OTs, to kind of figure out, okay, let's take this evidence-based approach and integrate it into our occupational therapy sessions to kind of remediate these visual efficiency skills, like you said, after concussion, convergence insufficiency, accommodative issues, eye movements. And so it kind of gave us an evidence-based protocoled approach to use these vision therapy interventions in our OT sessions to really improve those skills.
Yeah. And I think it's really important to connect to one of Dr. Masters' articles, from 2016, where 69% of, kids had one or more of the following vision diagnoses. Usually these things don't happen in single file, components, but accommodative disorders, so monocular disorders, 51%, convergence insufficiency, so a binocular disorder, 49%, psychotic dysfunction, aka how we're reading and how we're interacting with our phones, our tablets, our computers, newspapers, if people read those anymore, 29%, 46% of patients had more than one vision diagnosis. So you're looking at about close to half. And then, similar findings in, the Scheinman article as well. But again, it's kind of like, if we're thinking of a rotator cuff, and I'm going to geek out a little bit as a physio, right? So if we're going to think as a rotator cuff, and we're going to think of like, okay, patient is unable to flex beyond 45 degrees of flexion and 20 degrees of abduction. Well, again, those are just measurements, but how does that function in their day-to-day life? And it's like, who better than a PT or an occupational therapist or one of our interdisciplinary teammates from a rehab perspective, and I say this both as a provider and as I've, stated publicly on the podcast, is I live with persistent post-concussive symptoms. And when I was going through my 10 to 14 hours of rehab a week for 14 months from 2013 to 2014, my OT was really kind of took the lead there and really negotiated, how I was functioning in space. And I'll never forget, Meg taking this like 3-inch binder because I was doing private practice. And she was like, find me a rolling walker, find me an elevated toilet seat, and find me something else, right? And I remember having to scan and go through that. And it was that moment where we were working on all of these individual, as a patient, right? Not as Dr. Schwartz, as patient Jess. We were working on these individual things, of accommodation and vergence and things like that. And then when I had to put it together, I totally decompensated. And for me as a provider, that was like this aha moment of like, wow, this is a struggle bus. But who better than an OT to kind of put this together in that? And really, she took the lead, and that was really, so I'm really forever grateful to the profession. But so I'd love to kind of hear rehabilitatively, as we wrap up here, why is this so important to have an OT integrate these individualized deficits, and how does that pertain to the function of the patients in front of you, from school to play to family to how they're negotiating space? And as we have another 3 to 5 minutes here.
Yeah, absolutely. And I tell my patients and my families that I think as OTs, we're so uniquely qualified to provide interventions in these areas for all the reasons that you said. So as part of my training with Dr. Scheinman, got these beautiful protocols. If convergence insufficiency, then this. If accommodative dysfunction, do this. And that's great. And we're so lucky to kind of have this evidence-based jumping off board. But then what do you do when you have a 6-year-old with a concussion who doesn't know their letters yet and isn't going to sit and do the traditional vision therapy tasks with you for 45 minutes to an hour? I think that's what's really special about OTs, is we can kind of think about, okay, how can we change this up? How can we make this fun? How can we make this engaging? On the flip side too, we have a number of some of our older patients who, on traditional testing score, like they shouldn't be having issues. But then when you kind of dig into what's going on functionally, it's like, okay, you can do the task, but then when we think about what a typical school day is, and the fact that you have 6 classes that are an hour each, and you have to drive there to and from school, and you have to manage the lunchroom, and then soccer practice, that it's more of an endurance issue that's kind of impacting you. And so then again, we have to take our evidence-based protocol and kind of say, okay, how can we adapt this? Because it's not these quick hit things that are problematic for you. How can we really adjust our protocol to really address your needs for more of these like endurance type tasks? And so I think that as PTs and OTs and speech therapists, we care about function. We don't necessarily, we use our standardized testing to kind of guide and make sure that we're making progress, but we really want to know, where is the breakdown happening in your day, and what can we do to make sure that you can get back to those things comfortably?
Yeah. And I think OTs in general are so uniquely qualified to like fully understand the person, right? So from environment to their person, to their family life, and really looks at someone 360, I think very uniquely, that most providers don't. So what I think is so exciting is that in our next episode that we'll record, we're going to actually look at like, what does rehab look like for you? And what does like a session look like? What are patients coming in? What maybe tools you're using? Because again, we're not having to reinvent the wheel here. A lot of this stuff is really super inexpensive. It can be done. We want to make sure we're doing ethically and transparently, that we have training in these areas. But once it's done, it's a really neat rehabilitative space to be in, because it's so rewarding to see people just get back to doing the things that they love, where it's not something with a Band-Aid or a crutch. They're actually negotiating their space and social life and family and school life. And it's really awesome 360. And just to comment, I thought it was so salient because, this week the international consensus statement just came out from BJSM. And it was such a great thing you just said, just to wrap up here, is that you said that a 6-year-old may not know their letters yet. And what's great is that they're actually kind of moving away from baseline testing for kids, because there's so much development that happens between 6 and 12 and then 13 and 18. And I'm not quite 40, but I feel like I'm still developing. So here we are. So
exactly. Hopefully we all are.
Yeah, exactly. Right. When we get stagnant, I should need to wrap up shop. But yeah, I think that's really great to hear, that you can ebb and flow and negotiate for little kids that don't know their letters. And it's like, just being able to think outside of the box. So I'm super stoked to talk to you about what rehab looks like for you in part 2 of this podcast series. In terms of, I know you're not on social media, so we usually ask how to find you. I guess if someone is looking to refer to you, how about that? How can folks refer over to you over at CHOP?
We have a phone number, which I don't know off the top of my head. I believe it's 215-490. I apologize.
I will put it in the show notes, and that's how that works. It's pretty magic when it does.
I know. We definitely have, just like honestly at this point, you can call the occupational therapy scheduling line, and all that is in place in the back end to get you to the right people. So.
Excellent. And when they're going kind of through that triage at CHOP, what's the process? Does like a nurse coordinator kind of do the intake, and then do they go through the physician, or can they direct access to OT?
For our concussion patients, we're really lucky. So our concussion patients usually follow in our outpatient concussion program, and it's usually our physician who will kind of make the referral to OT. We do require a prescription from a medical provider, from a doctor, before we can initiate services. So the concussion kids traditionally will come through our concussion program, but we do have some clients who just self-refer and get a script from their PCP and find their ways to our doorstep, in which case we'll kind of make sure that we've checked all the appropriate boxes. But definitely a little bit of both, inside a referral and some self-referral of parents, patients who have kind of found us on the internet, Google searching, through a friend, however those things
on a
happen.
Podcast. Yep.
On a podcast. Exactly.
Yeah, exactly. And that's our goal, is that we want to make sure that our kids and our patients are getting in early and swiftly. And we know things take time. So really don't delay. Make sure that if you are a physician listening to this, or a physician parent that, 1 in 4 adults have had or known someone who's had a concussion, please make sure that we know that this is a rehabilitative injury, even in 2023, and that we get our patients into the right providers. So super stoked to have you on, Jordan. We'll have you back for part 2. And thank you so much for coming on.
Yeah, thanks so much for having me. I appreciate it.
Thank you for listening to the Concussion Corner, hosted by Dr. Jessica Schwartz. The information in this podcast is for entertainment purposes only and not to be used as personal medical advice. Don't forget to follow us on social media on Facebook, Instagram, Twitter, and YouTube at Concussion Corner.